The additional required reading this week by Malcolm Parks really points out the relationship between the quality of relationships that you have, so the quality of your social interactions, with your physical and mental health, your quality of life. Now, many people kind of take this for granted or don't really understand the depth of the relationship between those two things, but Parks really helps us to see, especially as we start to think about things like psychosomatic diseases, that the way that we feel about ourselves, the way that we feel about our interactions with other people, the quality of those interactions, the skills that we have in social interactions are going to have wide-ranging consequences for our physical and mental health. A good illustration of this is some work that's being done looking at how patients and their doctors interact with one another. And what they're finding, especially in oncology cases, that is cancer patients, that if the doctor has high hopes and communicates a very positive attitude toward the recovery of the patient, that the chances of that patient recovering increase dramatically. That vein of research is really telling us a whole lot about how our relationships and the quality of communication that we have and the perceptions that we have a big impact physically for us, not just mentally. Now, first we're going to look at social skill deficits and how that has an impact on our quality of life. Now, there are a number of different social skills that are very complex, difficult to manage unless you had, through growing up, very good examples set before you, that is, models set before you for how to adhere to norms in things like perspective taking and turn taking in conversations, regulating your emotional expressions and how you manage those emotions in front of people, constructing persuasive strategies so that you are able to basically have some assertiveness within your communication encounters, managing conflict effectively, being able to know when it's appropriate and not appropriate to self-disclose. These are all sorts of skills that we need, yet if you didn't have that modeled appropriately before you that met the cultural norms of the culture that you live in, then you don't know how to interact with other people very effectively. And what happens is the quality of the interactions that you have later on in life, they really are depleted, and you don't have that social network that enables you to be able to maintain and especially initiate new friendships with coworkers or people in class around you or any of that sort of thing. Now, your relationships are rolling laboratories, so to speak, because we learn from them, and it's never too late to begin learning some of these norms. So even if someone didn't have necessarily a family relationship that taught them how to enact these skills outside the family, then through the course of their life, through their rolling laboratories of relationships, they can learn these things. Another thing that we need to look at in terms of its effects and consequences for us are those related to violence and suicide. Violence and abuse in personal relationship really poses a profound problem, not only for individuals, but for society as a whole, as we try to learn how to enact healthy relationships in which there is no abuse, and that would be our aim. Now, violence in dating relationships oftentimes leads to patterns of violence in marriage relationships, and it carries over into new relationships, especially if you look at the roles of either the abuser or the victim. Many times the abuser will continue that pattern of abuse later on in future relationships, and the victim will continue to get involved with those that are abusive and have a cycle of victimage and be an enabler. And it's very difficult to break those cycles once they are established as patterns, and it becomes a pattern of violence, a cycle of violence. Also, those that were exposed to violence within the family at a young age are more likely to repeat those patterns of violence later on in their own relationships and their own family relationships. And this is another very interesting example that a group of researchers found through their research with school children, and that is that if they don't have strong reciprocated friendships with other people, then they're more likely to bully their classmates. So their response to not having a healthy relationship as even a child is to be violent and aggressive to others. Now, as you start to look at this, you also start to think about things like effective suicide on people. You have loneliness and a variety of other things, including more serious things like clinical depression, that are linked to not having healthy relationships and not having a good social support network that can help you through problems like that. And many times those can precipitate into suicide. And this is something that after it is completed, it's irreversible. You can't go back and reverse it. I've taken a number of classes related to health, and in one particular women's health course that I took, we were looking at some of the statistics related to suicide, and it's fascinating that men are basically, if they attempt suicide, they're much more likely to complete the suicide, versus females, if they attempt the suicide, are much less likely to actually complete the suicide. So those are some interesting statistics related to it, but you have to understand that if someone attempts it, they're very serious about it, and the consequences can be completely fatal. Also, you have cardiovascular disease. Your stress level and your relationships, especially if you can't handle conflict management very well, is just exacerbated. In the case when you have poor physical health, such as cardiovascular disease, it can actually affect the onset of a heart attack. And also, if you have a very good social support system, like friends and family that care about you, they can help you to make the sort of lifestyle changes that you need to in order to live effectively with cardiovascular disease. But if you don't have that social network, those people that are encouraging you to exercise and change your diet effectively, and to help you de-stress and engage in activities that help you to relax, then chances are you're not going to be able to make those sorts of changes on your own, and your health is going to deteriorate likewise. Another thing that affects you in terms of your physical health is your immune system related to your social relationships. If you don't have meaningful, intimate relationships with others, it can have a very big impact on your ability of your body to fight diseases. People are more likely to get sick during periods of interpersonal stress. How many of you have gotten stressed out during finals week and you find yourself getting sick afterwards, and you end up spending maybe the first week of Christmas vacation or the first week of summer vacation actually in bed taking medicine, and you're thinking, this is not how I wanted to spend my vacation, but maybe you got so stressed out and you had that weighing on you that it had an impact on you physically. Also, depression, loneliness, family conflict, role conflict, separation from family and peers, divorce, bereavement, all have a huge impact on your immune system. In fact, when children go off to college after they graduate from high school, and so they're becoming adults, they're embarking on a world in which they're going to be very autonomous, sometimes that's the time in which they also experience a lot of loneliness and separation from their family that were there. They don't have that support system, and they get sick more often because of it. Also, risky health practices have a big impact in relationship to your social interactions. You're more likely to engage in risky health practices, such as maybe something like street racing or illicit drug use or binge drinking, smoking, all these sorts of things, if you don't have a very strong social support system, or if the people in your social support system are engaging also in the healthy risk practices. That is, if you have a peer group that is abusing illegal drugs, then your chances of engaging in the use of illegal drugs is going to be higher than somebody else. So your relationships have a huge impact on your engagement in risky health practices. Those people that care about you and love you and can direct you to health practices that are less risky, that can help to build your nutrition, the health of your body, and your mental health. But if you don't have that sort of social network, then in many cases you don't have someone that prevents you from making very poor choices.